Good day, everyone. My name is Oladoja from Nigeria, and I'm making presentation on behalf of me and my teammate, Alam Mayaba from Zambia, titled "Should AI-powered genomic analysis be used in Africa healthcare system even if it risks algorithm bias?" We're in Group 9 and we are affirming this statement. Basically, we have known that artificial intelligence has come to stay and it is necessary, especially in this part of the world, Africa, that we should also embrace the technology because it has come of aid. Although many people have been skeptical in this part of the world, but we all know that this is what we need to embrace because it has solved many problems, even because of time. Although it may be expensive, but we have known the impact on our health system. So because at times, even if our people are sick, they have to transfer them to the Western world, and they've embraced power of AI. So, and this is what we are affirming that we should also embrace in this part of the world. We know that most artificial intelligence bias stems from a lack of diverse data, because in this part of the world, in Africa, we know that data is what is very inefficient. We lack accurate data. So, and this is what we need to work on for AI to thrive in Africa. We know that Africa genomic data increases accuracy and equity. If we have accurate data, we know that what we are skeptical about AI will not be our issue, and we should know that integration is what we need as the solution, not exclusion. So we know our argument is based on transformative potential for healthcare in the power of genomics. So AI can process genomic data sets quickly to identify disease risk and tailor treatment and accelerate diagnostics. So that's what we are trying to affirm. And also, it aids our precision medicine for African population. Due to our population, if we imbibe AI, we know that it will increase our precision medicine, and it will help us to analyze genetic diversity in African genomes, leading to treatment and medication tailored to African specific variants. And bias will be mitigated if we have accurate data in Africa, and this will help us to adapt to the continent's unique population. Also, in the long run, it will be cost effective, because when we invest our resources into the use of getting accurate data, artificial intelligence will help us to be useful in detecting outbreak response, newborn screening, rare disease detection, and cancer genomic. And this will also widen our health gap knowledge, because other continents are already advancing rapidly with AI. Also, we cannot overemphasize the issue of complex data analysis. Artificial intelligence will help us to analyze this because of the vast nature of how to train and test data. And also, better driven AI genomic will help with vaccine surveillance and pandemic readiness, because nothing will meet us unaware if we imbibe the use of AI. And also, it will project support African-led research, skill development, and governance. And our rebuttal is that um the people in our opposition will say it will the inevitable risk of patients harm. It will not risk there is no harm, because data has shown that in the Western world, after venturing into the use of AI into healthcare system, we have seen that there is an improvement in healthcare in the Western world, and the rate at which people die have reduced drastically because of this artificial intelligence. So deploying AI tools will directly lead to improve patient diagnosis and reduce the risk of loss of life in African clinical setting that lack of adequate diagnostic equipment. And it will also reduce the effect of airborne and waterborne diseases, because AI will help us and will give us informed decision of what to do and what to know. And we know in African healthcare system there is always misdiagnosis of patient due to poor limited resources, and this is what AI will help us solve. It will help us solve the issue of clinical error which delay life-saving treatment, and it will bring solution to manage these challenges that are persistent in African healthcare system. So we should know that the use of AI does not violate any fundamental principle of medical ethics and justice. It has come to stay and we need to embrace it thoroughly. So denying AI genomics is denying potential breakthrough in Africa healthcare system. So responsible innovation, not retreat, is the pathway forward. And these are our references. Thank you very much for your time.